Hi, I want to talk with everybody a little bit about bladders and surgery. So bladders are not any different than any other organ. When you have surgery, the bladder will be sore and tired. It will also be disoriented, and it will not communicate very well with the brain at first. It is very hard for me to predict who's going to have a bladder that wakes up quickly and functions normally quickly, or whose bladder is going to be delayed. People going into surgery often remember that I asked a lot of questions about the function of the bladder. In other words, I asked a little bit about frequency. How often do you urinate? How often do you have to deal with urgency that is uncontrolled? How often do you have to strain to empty your bladder? There are a lot of different dynamics at play when the bladder is repositioned during surgery. One dynamic is the bladder's in a new position and has to figure out where it's at and how to function well. For many people who have very saggy bladders or the bladder is hanging low, the bladder actually has to push the urine up and out. And when I reposition it in an upward position, then it's the top of the bladder that has to work. So one very basic principle is that when the bladder is in a new position, this balloon-shaped muscle has a different part of the muscle that now has to work to empty. And that muscle is slow in its communication to the brain, and it's also weak because for most people, that part of the bladder has not worked well for some time. In other words, it's been relying on the lower part of the bladder, and now in its new position, it will rely more on the upper part of that bladder muscle. So that's one thing that's going on that makes your bladder slow to wake up. In addition to, like I referred to before, the change in position, the disruption of muscle and nerve fibers being put back in their normal location as much as possible. And so all of that will lead to your bladder being slow. So there's only one way to rest the bladder muscle. When a bladder muscle is tired, sore, not emptying well, disoriented, there's only one way to rest it, and that is to put a catheter in it and let the bladder just collapse in and relax. That's the equivalent to somebody after surgery using crutches, or somebody after surgery wearing a sling for their arm. That's what we do for the bladder to relax. And that's why you may end up having to go home with a catheter. And I generally try to make sure we manage people who have catheters in through the office. Some people will have a spouse or a significant other or a nursing family member, for example, that can catheterize them. But most of the time we'll do the voiding trials, which is trials to see how we can wake your bladder up from home, and have you take the catheter out yourself with a pair of scissors. There's another video on that. And then come into the office where we can test periodically to see when it's waking up. If your bladder doesn't wake up properly over a long period of time, this is uncommon, but if that happens, then we will look at doing some treatments, specifically neuromodulation. And those treatments are designed to reconnect the bladder and the brain so that they can communicate well. There are actually many people that I talk to about the fact that there are anatomic symptoms and neurologic symptoms, meaning certain symptoms are related to abnormal anatomy and certain symptoms are related to abnormal neurology. Both the anatomy and the neurology, both the muscles, tendons, fascia, anatomy, and the little nerve fibers that run through the pelvic floor tissues can get damaged, specifically with heavy lifting and childbirth, etc. So when those structures are damaged, an anatomic fix will not always fix the neurologic damage. And so I have this discussion with people not too infrequently about the fact that I might even say to them, I don't think your bladder is going to wake up well after surgery because it's already showing us that the bladder muscle itself does not coordinate well to empty thoroughly and adequately. So those people are people that may end up wearing a catheter for even a couple weeks, few weeks maybe. Rarely I'll have somebody wear a catheter intermittently for a month or two. That's very rare. But even when bladders wake up enough to empty well, you may have some continued straining to empty your bladder, which may be self-resolving. If it's not, we look at other things like neuromodulation to fix that ability of the bladder to communicate with the brain well enough to empty this way. So if you go home with a catheter, don't be afraid of it. This is just like walking around with crutches or wearing a sling on your arm. We're giving that bladder good rest, and we'll work through this and get your bladder to wake up and function normally.